What can you expect from a C-section? We spend a lot of time discussing what to expect in labour, from vaginal childbirth, but for many people, they don't have that option. Might have a breech baby, you might have had previous caesarean sections, or you're simply requesting a caesarean section for your own reasons. Even if you have no intention of having a C-section, around 1 in 3 births end in a C-section, many of which are emergencies. So being prepared and aware of what you can expect and how you can still have a positive experience can change what could be potentially very stressful into an enjoyable experience for you. I'm Dr. Brooke Vandermolen, an obstetrics and gynecology doctor, and I am here to talk you through C-sections, why they might be suggested, what happens, and some of my top tips for recovery. Working as an obstetrician and performing C-sections is pretty much our bread and butter. It's the first operation we learn to perform, and we routinely do at least 3 every labour ward shift as a registrar. So even though for me this setup is very normal, I am aware that as parents-to-be, being wheeled into an operating theatre, awake, often with little notice, can be an alien or even terrifying experience. So I'm here to clear it up for you. First up, what is it? A caesarean section is an operation usually performed through a low incision in the lower part of your tummy, across the tummy, close to your bikini line, in order to deliver your baby. It might be elective, which means planned, or it could be emergency. And to help us determine the urgency of the procedure, we divide them into categories, and it often depends on the reason why the caesarean section is being recommended in the first place. So first up, we'll have category 4. So category 4 caesarean sections are elective, they're planned. This means that you'll be scheduled on a planned list at a time that suits both you and the hospital that you're giving birth at. This will normally be planned for around when you're 39 weeks pregnant, unless there's any particular circumstances that mean that you require to have your baby delivered earlier than that. You might be advised to have a caesarean section, or even you have chosen this plan for a variety of reasons. That could be the position of your baby, so your baby is breech, where its bum is down, or you've had a number of caesareans in the past, or it might just be your preference. The next category is a category 3 caesarean. These types of caesareans are classed as emergency, but less of that kind of flashing light running down the corridor to theatre kind. So it might happen if you require delivery, but you and your baby are well, and it can wait a little bit. So for example, you could be in the early stages, or you've had an induction of labour, things aren't really progressing. So these types of caesareans will normally be timed during the day with plenty of people around. There's no imminent emergencies pending. So we would usually aim to do that the same day we've made the decision to go ahead with a category 3 caesarean section. Next up is category 2. So this is also an emergency type of caesarean section where your baby needs to be delivered fairly imminently, but there's no immediate risk to life to either you or your baby. We'd aim to deliver your baby within about 75 minutes of making this decision. And there's some reasons this scenario might be. So it could be that your labour's not progressing, or your baby is showing signs of difficulty, so they've got an infection on board, or it's not critical, life-threatening, but combining with the other facts, we feel that actually going ahead with a caesarean section is more beneficial than waiting for a vaginal birth to happen. Finally, category 1 caesarean section. This is the bells and alarms, rushing type of emergency. In reality, it doesn't happen that often, but if there is a concern about the imminent well-being of either you or your baby, then we'll move as quickly as possible to theatre to deliver your baby within 30 minutes of making that decision. Things happen fast in this scenario, and it can be a bit overwhelming and scary. It might be that an emergency buzzer will be pulled, or unless there's doctors already in the room, and a number of people will often show up. If the decision for a category 1 caesarean section is made, it will be all hands on deck to get you to the operating theatre as quickly as possible, so extra people arrive, and we'll often be quite quick in discussing how to get your verbal or written consent and get you straight into the theatre. And just know that everyone is acting in your and your baby's best interest, and you should still have time to ask questions if you need to, but it's often the one that can feel the most scary. So what happens if you have a caesarean section? Well, first up, before the procedure, if it's planned in the run-up to the procedure, usually a few days before the expected date, you'll attend to have some blood tests, maybe some swabs for MRSA and COVID, and you'll have a discussion with the obstetrics doctor and an anaesthetist. You'll be advised when you should stop eating and drinking, and any other specific advice about your personal medication. You'll receive 2 doses of an anti-acid tablet, which you should take, and they'll give you instructions on when to take them. On the day of the procedure, you'll usually attend to the maternity unit either first thing in the morning or around lunchtime, and they'll give you the specific time. And then you'll wait. They might take some blood, listen to the baby, and to perform some vitals, some observations on you. You'll also meet the midwife that will be looking after you for the day, and they usually go through a full history set of vitals. If it's required, then you'll be measured for TED stockings, and then you wait. Your partner or your husband can be with you. And then it's just a matter of sitting and relaxing until you're called for the surgery, but in this time you can't eat or drink. You'll also receive a visit usually from your surgeon and from the anaesthetist for the day, and they'll check your history as well, and if there's any special requirements for the operation. So what happens when you get to the theatre? Well, before going up to the operating theatre, you'll change into your hospital gown with nothing on underneath. Then you'll have to remove any jewellery that you've got as well, and any nail polish ideally. You'll usually wear like a dressing gown or something to cover you over this. And the only other thing you need to bring with you to theatre is your baby's first outfit and maybe a blanket and a hat. It's a good idea to have baby's first outfit in a plastic bag so you're ready to go. And your partner can come with you to the theatre, but they're usually left outside while you're brought in to have the anaesthetic and get ready, then they can come in for the birth of the baby. You'll meet the team that'll be looking after you and they'll check your details and again go through some vitals, make sure everything's ready to go. And you'll meet your anaesthetist at this stage, they'll pop a cannula in your hand ready to go for theatre. The next stage is to be brought into the theatre and you'll be moved onto the operating table and you'll have your epidural or spinal anaesthetic usually if the plan is for you to be awake. So to get this done, you sit on the edge of the bed, your legs will be on a step and you'll be bent over slightly. So there's a curve to your spine and usually cuddling a pillow inside you, and the anaesthetist will talk you through every step so you know what's happening. Once that epidural or spinal is in and the meds have started working, you'll feel a heaviness or even a hotness that moves down your legs and you'll be helped to lie back onto the table. There'll be lots of people around you and they'll start to get everything ready. You won't be able to feel your legs after a couple of minutes, usually up to around your nipples. And then a theatre nurse or the midwife will also be setting things up in front of you. Your arms will be brought out to the side of your body and you'll be hooked up to blood pressure monitors and things like that. Whilst this is all happening, they'll be placing a catheter inside your bladder and getting you all cleaned up ready for the surgery. And all this goes by very quickly and you'll often be quite surprised. Suddenly, the operation started and the next thing you're told is the baby's coming out. The time from when you have the knife to skin to baby being born is pretty quick. It's around 5 to 10 minutes if it's your first baby, maybe longer if you've had an operation before. So all the other bits take much longer, but the whole operation can take about 45 minutes to an hour. Whilst the drape is up in front of you during the operation, you won't be able to see anything, but they can pull the drape down to show you the baby once the baby's been delivered. It's possible to do some delay cord clamping and more on this in a second. The baby will then be passed to the midwife who's looking after you to take them and check everything over. 10 fingers, 10 toes. They'll clamp the umbilical cord, weigh baby, etc. All this time, your obstetrics team is stitching you back up again. If there aren't any issues, then that can be done quite quickly and you'll be out feeding your baby in no time. The main risks to be aware of for this operation include infections that can happen in the wound and that you'll be given an antibiotic during the operation anyway to prevent this. The risk of bleeding, which can be severe enough to require blood transfusion, and sometimes you need to take extra steps to stop the bleeding, which might involve extra stitches, a balloon inside the womb, and your team can talk you through different options to help control hemorrhage if it happens. There's also a risk of blood clots in your legs, and that's why you wear some stockings and you'll get some injections to thin the blood. There's a risk of damage to your bladder and to your bowel as well, with any operation that you have. After the operation, you'll then spend the next hour or so in recovery, and that's so the midwives can keep an eye on your vitals like your blood pressure, your temperature, etc. It's a great chance to skin with your baby and get your first feed in. And once everyone's happy, you'll probably get moved to the postnatal ward. Most people spend about 1 to 2 nights in hospital after an uncomplicated C-section. You need to see how your recovery goes. If you want more tips on C-section recovery, check out my video on postnatal recovery. One thing that many people and their partners are surprised by is how many people are often present in the theatre. It can make you feel quite overwhelmed. So it can be helpful to understand who you might expect to be there. And remember that everyone is there, has a role to play in looking after you and your baby. Obstetricians. These are the surgeons who usually perform the cesarean, and we need 2 at least. They're usually a junior and a senior doctor who work together to do the operation. And sometimes there's a third person, the consultant, who might be present in theatre, or they could be elsewhere on the labour ward or available by phone, who we can call if there's any complications. The scrub nurses are specially trained to assist in operations by scrubbing in and handling all the instruments, ensuring that the surgeons are presented with what they need at the time. The anaesthetist is a doctor who's specially trained at providing pain relief as well as putting you to sleep if they need to. They'll sit near your head, closely monitoring all your vital signs, and they're the ones that can reassure you and talk to you throughout. The ODPs, the operating department practitioners, are assistants to the anaesthetist, and they help to prepare their equipment and their environment. The midwife, even if your birth is performed by operation, a midwife is there to support you for your birth, check over your baby and help you with feeding and your postnatal recovery. Now, the paediatrician, the baby doctors, will often be present for any emergency cesarean sections and sometimes in the elective ones if we're expecting the baby to need any extra support soon after birth. Healthcare assistants are vital members of the team for helping to move for you, also for cleaning or for gathering any other equipment that we might need. There's other staff members that might be available if we need them, like urology doctors, midwives in charge, extra anaesthetists. It can mean there's around 10 people in the theatre, maybe even more, and try not to be alarmed, everyone has a job to do. So what can you have to make sure that your C-section is a positive experience? Well, firstly, you can ask to play your own music. You can make a playlist. Usually the staff enjoy it too. And you can play it from your phone or a speaker if there isn't one in the theatre. Sometimes in emergencies, we do have to ask you to turn it down or turn it off so we can hear each other. It's not a guarantee you can have music on, but usually it's fine. Hypnobirthing, I've talked about this a lot, but breathing and calming techniques don't have to just be reserved for labour. You can relax yourself and separate your mind from the beeping of the machines and sickness or discomfort by practicing these things. You can also ask to drop the drape. So during the operation, there's a sterile drape, so you don't see all the gross stuff that's going on inside. But when the baby's being delivered, you can ask them to lower the drapes so that you and your partner can see your baby as they enter the world. And also delayed cord clamping. So this means waiting a few minutes before cutting the cord. Now, traditionally, we didn't offer that during cesarean section because of concerns about mum bleeding. But actually, we know that if the procedure's going really well, bleeding's not too heavy, it can be beneficial for the baby to have about a minute's delay before the cord is clamped, and they'll get a bit of an extra boost of their hemoglobin. The doctor may not be comfortable with this, so you just should ask before the operation. Finally, skin to skin. Now, this is where your baby is put on your chest soon after they're born. And again, more tricky in a C-section. We didn't used to offer it because there's the drapes, there's the machines, you've got cuffs on and monitors. Often if your baby is well, your midwife can help you to achieve this even while the operation's ongoing. So you can ask them if you can have some skin-to-skin time. Important to be aware that a lot of people don't realise there are side effects, obviously, of the medications you'll receive, and some people just don't feel up to it. You're lying pretty flat, which can be uncomfortable. You might feel nauseous. You might have the shakes as a result of the spinal anaesthetic. So don't be too hard on yourself if you actually can't bear the idea of having baby on your chest straight after birth. Your partner can hold baby until you're ready, and you can have plenty of time for skin-to-skin once you're around in recovery. That's it. We've talked about what C-sections are, what you can expect to happen, and some top tips for a positive experience. If you've enjoyed this video, don't forget to check out the rest of my channel and subscribe to keep up to date with more evidence-based videos about women's health. Let me know if you've got any questions in the comments below.